Good evening and welcome to Responding to COVID-19, a virtual celebration of hope and healing at St. Boniface Hospital. My name is Diane Currier and I am the Board Chair for Health Equity International. On behalf of all of us at HEI and St. Boniface Hospital, thank you for taking the time to join us tonight. This has been a very challenging year for all of us. The pandemic has changed all of our lives and it has personally affected many of you. Our staff have been deeply moved to know that despite the challenges you faced in your own lives, you have remained unwavering in your support of St. Boniface Hospital. Supporters like you ensured that St. Boniface Hospital was ready to meet the COVID-19 crisis while continuing to treat thousands of patients who depended on us for life-saving care. Because of you, this year, nearly 3,000 women had a safe place to deliver their babies. Because of you, over 800 tiny infants grew healthy and strong in our neonatal intensive care unit. Because of you, nearly 3,000 patients received life-saving surgical procedures, including cesarean sections. More than 300 children grew healthy and strong in our pediatric inpatient department, and nearly 6,000 patients received life-saving care in our emergency room. St. Boniface's community health team continued to work tirelessly in the communities we serve. Throughout the pandemic, they conducted over 1,000 health education sessions on topics such as social distancing and hand hygiene. They also helped schools to safely reopen by helping to implement hand washing stations and by ensuring that each classroom had enough tables and chairs to keep students at least 6 feet apart. Finally, they held over 250 rally posts where they provided basic primary care to thousands of women and children. In total, due to your generosity, we have seen nearly 100,000 patient visits so far this year. With your support, we changed countless lives. Tonight, I am renewing my commitment to Health Equity International and the people of Haiti. I hope you will too. This year has shown that we need to work together to overcome the great obstacles that lay before us. And we are so very proud and so grateful that you are on our team. Now it gives me great pleasure to turn you over to our hosts for the evening. Here are Connor Shapiro, our President and CEO, and Dr. Inobert Pierre, the Director General at St. Boniface Hospital.
Thank you, Diane, and welcome everybody to the 2020 annual Gala. We're doing it, as you know, virtually this year, and we're excited that all of you have been able to make it and attend. Thank you. And thank you for all your support. As everyone on this call knows, 2020 has been a beyond challenging year that we could not have predicted. In March, when the U.S. shut down, we immediately leapt to action in Haiti and set up our COVID unit, and were able to treat those with COVID who came to the hospital and continue to protect everyone else in the hospital. Our team in Haiti showed remarkable courage and bravery, led by Dr. Pierre and the rest of the entire team. The fact that they were able to stand up and quickly make sure that everybody received the care they needed, despite the fact that there were so many unknowns around COVID. Everyone from the Haitian team, from the team in Boston to our supporters, all rallied to the cause and have made it so that we've been able to keep the hospital open and that our staff's been able to do their job. So thank you all tonight. We look forward to talking to you about everything, but I'll pass it over to Dr. Pierre in Haiti. I will say that tonight, one of the cool things that we have is that we can be live with Fond de Blanc, and Dr. Pierre can talk with us and through the wonders of Zoom, although I think we're all pretty zoomed out at this point. Through the wonders of Zoom, we're able to really see Dr. Pierre and Dr. Pierre can participate fully.
Hi, everyone. I'm so happy to be with you this evening. Although I would be happier to be with you all together and sharing this special moment, but because you've been supporting the work that we do in Haiti, I am glad to show you some of the work that we do on the ground in Haiti, the work that you support. So we are very fortunate to have you during these critical times where the challenges are everywhere in the world, to have you as our supporters. We know that when challenging times come, the ones who are the most vulnerable will suffer the most. So that's why we value so much your support.
On March 19th, that's when we identified the first cases. We knew that if it's in Port-au-Prince, it was just a matter of days before he gets here. Just a few days later, we had our first patients. We, in total, received 204 patients. Only 12 of them died.
Absolument, comme d'aller pour faire l'homme pour l'hôpital là, patient. Yo dou c'est pas l'hôpital c'est Boniface. Yo te ka perdu, yo te ka mourir. Ça te fait me sentir fier de tête moi. Et m'koy année ça fait moi j'ai 26 ans. M'te fait 4 jours couché dans l'hôpital là, couché dans Covid. Dès qu'on la fièvre, il fait sous la fièvre duré sous moi fait 2 jours. Mais on joue de venir toujours, les de venir pas de comme minimum les de pas qu'à venir. Et puis docteur Pierre était à l'hôpital, docteur Pierre Elim, il dit moi faut moi venir à l'hôpital pour faire pour regarder pour ça il capable faire pour moi parce que yo doit ça. Il y a un docteur qui dit bon boss Raymond et n'a voulu aller la caillou. Nous tout bail en forme pour n'a voulu aller la caillou.
We were affected a lot during the COVID period. It was hard to see some patients that they've been to 3 or 4 other hospitals on average before coming here. So we were basically doing all emergencies during that time. Half of our patients are urgent. This number is going up because COVID affected a lot of hospitals in the Southern Peninsula.
Plus ça qui te caractérisé nous surtout, c'est solidarité qui te gagne entre équipe qui t'a travaillé dans Covid là. On tombe malade ou même qui était là pour bailler soin ou perdu pas bailler soin, mais qui est-ce qui vient bailler soin? Donc c'est nous pour camper. Donc c'est comme ça, tu vinn une conscience collective qui te vinn soulever et puis tout employé net te dit que y a yo prêt pour yo bailler soin. Si bien que c'est Boniface, c'était seul centre qui te gagne dans le département sud là qui pour te recevoir moun yo. Les Covid, la majorité des malades qui viennent là, c'est l'autre côté où et nous sommes toujours prêts pour nous battre. Nous n'avons pas peur du tout pour nous aller dans la communauté.
Moi-même, c'est Natus Geline. Moi, j'habite à Murier. Je suis enceinte là, dans la période, ça vraiment, je me sens stressée. Parce que la maladie a fait travail, parce que je ne sais pas qui gens. Parce que je suis sur le mal à l'hôpital. Je suis arrivé à l'hôpital, je suis stressée parce que je suis en pile monde. La première petite, je fait la caille. Après, l'autre 5 jours, l'hôpital Saint-Boniface.
Le patient qui n'est pas venu à l'hôpital parce qu'il y a une rumeur que l'heure venu à l'hôpital, donc il y a des médicaments qui sont contrariés. Donc comme ça, mon était surtout resté la caille. Et puis ils venu à l'hôpital très tard.
L'hôpital a plus bon parce que quelques bagailles, le accoucher la caille ou pas junior. L'hôpital là au plus bon toujours parce que le docteur parce que pas qui arrive.
Nous toujours dire que masque non porté, non pas porter pour protéger tête, non mais non porter pour protéger monde qui est en face là.
Je suis stressée parce que moi maladie parce que moi j'ai un bébé parce que toujours dit monde qui est enceinte maladie a plus bagaille même stressée mais je t'ai toujours respecté règles là moi était cache-nez après l'amour avec cache-nez.
Moun qui dans maternité, c'est vrai que maternité pas qu'à camper par le fait que mon a toujours venu accoucher. Mais tu as gagné moun qui disposé si toutefois qu'on a envahi nous
il était bien regardé. Il était bien regardé moi. Il était parlé avec moi, pas de me coucher, il parlait avec moi, je me sentais que c'est un monde moyen. Si moi j'ai un service, un malade, un traitement pour être moi, je ne suis pas capable de me sentir normal. C'est pour me dire merci, c'est Boniface.
It came out that change has been still, wish. But I think that energy, if I invested in caring for my fellow citizens, in making sure that they feel that at least in one place in this country, they can be treated, no matter how poor they are, as a human being, with respect, dignity, with love, compassion. I think that my life won't be wasted.
The most impressive thing to me over the last year has been the courage and bravery of our team and the ingenuity of our team. I mean, in March, our team didn't know what the outbreak was going to look like, how we were going to procure the PPE that we needed, and how to make sure that we could take care of patients as they came in and as they showed up with COVID. And in the end, our team really stood up. We had tons of volunteers, Haitian doctors, nurses, lab techs, drivers, all stepping up to make sure that we were able to handle COVID and to do that in the face of great uncertainty. And it was a true inspiration, and it's exciting to have been able to be part of that team and just to try to back up the team on the ground in Haiti, really putting their lives on the line for our patients.
So we at Health Equity International is mission-driven, and every patient is so important to us. So we make sure in our day-to-day life and work at the hospital that we care for every patient that shows on our doors. And every employee at the hospital would have some amazing story to tell. So tonight, it is my pleasure to share with you some of the stories told by the staff regarding patients that I've been caring for, and all that with your amazing support.
A patient that really impacted me was a young girl. She was referred to us from Port-au-Prince with typhoid complication. When I arrived, after physical exam, I concluded that it was a typhoid perforation. And after preparation, I took her in the OR.
One of them is the story of a preemie baby girl. She was delivered here at the hospital, but very tiny, very premature, and her mom actually lost hope and left because the baby was so premature that no one thought that she would survive. But we at St. Boniface Hospital, we think that every life is sacred and we need to fight until the last minute to save every life.
An older female, a diabetic one who was referred to the hospital for diarrhea and also vomiting. The doctors from this hospital thought that she probably has only a gastroenteritis, an acute one. In fact, when she arrived here, I always thought that she probably have another problem. I decided to realize an EKG. Thanks God, unfortunately, we have one here. And effectively, she has a myocardial ischemia, a massive one.
So every patient with typhoid perforation are also malnourished. And then that's the hard part in Haiti with a disease like this, because you have to take care of the disease, but not only the disease, you have to take care of the patient. She stayed here with us for over a month, taking care of the ostomy and taking care of her nutrition. She almost died from a disease that is avoidable.
We endeavored to make all the efforts necessary to save that baby. At some point, she got infections. We treated her for infections. She became very anemic. We managed to go to Port-au-Prince to get blood, and we transfused her. And surprisingly, after about 6 weeks in the service, she started gaining some very modest weight, because that was the first sign that we were moving in the right direction.
I will never forget that woman, especially his son, who was only 20, who were really upset. We was really afraid for his mother.
She was hospitalized for days at a clinic, at a hospital in Port-au-Prince. But as you know, care is not free here in Haiti. She couldn't afford the fees of surgeries and everything. She was referred to here. And then we did that for absolutely no money, and we saved her.
After days of research to find the mom, and handed her baby. You just can't, explain how happy that mom was, because she loved that baby, and she didn't just want to see her suffer, and because she was hopeless. Now it's more than 10 years later, and that girl has turned into a grown-up and such a beautiful young lady. And we are very proud. And the mom still today, keeps calling us, saying that actually we are the real dad of that baby.
I will never forget that day. This is what make us physicians here very happy when we can say we did it.
Recently, she sent pictures to the head nurse of her graduation, and she said something like that she could finish her training at university. It's because of the work team, the nurses, the doctors at Boniface Hospital.
I really never met anyone like Jim, but the thing that really made me a lifelong Jim Ansara fan, other than meeting his wife and children, was just seeing his practicality. I mean, this is a guy, an action hero. His superpower is building things. There have been people now on 4 continents probably who have benefited directly from his efforts. And when I am lucky enough to go to St. Boniface, one of the things that strikes me, this work looks familiar. It looks solid. It looks beautiful. It looks functional. And those are the trademarks of Jim Ansara. This is a person who believes that, where you're born or how you're born should not dictate whether or not you'd have access to schools, hospitals, other public function buildings that are beautiful and dignified. By any standard, we need a lot more help to build safe spaces or to take unsafe spaces and make them safe. And that is not a job we can do without the likes of Jim Ansara. If I had to look back over the past 60 years and say, what's the worst thing that I ever saw? It's head and shoulders, the earthquake in Haiti. So it's a pretty dark time. And, you know, Jim Ansara's arrival lifted up our spirits, but it also meant that a lot of new friendships could be forged, because tragedy also brings people together. And you're about to hear from three people who met because of the earthquake, at least as a trio. One who will be well known to you if you've ever been to St. Boniface Hospital. Another who is a Haitian physician, who is a Harvard faculty member and a close friend of mine. And the third, the man we're honoring tonight.
So every project that Jim and BHI have done here stands by itself and is so important, so crucial to the country that I just can't tell which one has the most impact. Jim has an indisputable contribution to the Haitian healthcare system. So what do you see as the most important change that we've been able to make with the help of you and BHI?
You know, I think there's been a lot of changes, and it's easy to talk about the physical buildings, the brick and mortar, and all of those are important. But we have been able to, with your leadership, Dr. Pierre, and support from Connor and all the team in Newton, really build a team that will do whatever it takes to serve the people of Haiti in the Southern Peninsula and beyond. And that's very, very important. And there is an attitude throughout the organization of selflessness and service that you don't always see in Haiti or other countries, including the United States, in medicine. So I think that part of the success at the hospital isn't just the bricks and mortar, isn't just the fundraising, but is the culture that you have all built. And it's so critical.
One thing that has always caught my attention is the fact that you don't have a double standard. So you're building places here at the hospital for poor people, but with the international or the US standard. So you're making it such a great place. So that says a lot to the kind of person that you are.
Thank you, Dr. Pierre. I appreciate that. But I see it as not generosity on my part, but an obligation. I enjoyed incredible opportunities and privilege growing up in Boston, where I had access to good education, to jobs, to be able to start my own business. And I believe that quality, dignified healthcare is a human right, and it shouldn't be limited to the global north, that people in Haiti or East or West Africa or wherever they may be should all have access to great healthcare.
Jim, you and your family and Karen have been incredibly dedicated to Haiti in so many ways, and it's been for so long. You've really thrown your whole lives into it, both in terms of the work that you do on a daily basis, but also in terms of your giving as well.
Karen has really been the driver in many ways for our work as a couple and family in Haiti, and she continues to be. She is incredibly committed, and when I get pessimistic and sort of start suffering fatigue from sort of the many setbacks that we all see in Haiti, Karen is always the person who says that we have to keep going and that things are getting better.
I've seen you, work, day and night to make sure that we improve the health conditions of so many people. And when patients come to the hospital and they feel comfortable, they feel that they are treated with dignity, they have no idea who is behind the improved conditions. All the Haitians, who come and see that the country can be different. And when they come to the surgical center, for example, to have training, they see a very different model. And I know that will have a very durable impact. So for all that and more that I just can't name here, thank you very much.
Thank you. You're very welcome. And it's a privilege to work with you and the staff and the entire organization and to serve the people of Haiti. And I hope we can do a lot more in the future. We have made a good start, but it's only just a beginning, and we have a lot of work to do. And I remain very committed to doing that. So thank you.
It's my great honor and privilege to be able to recognize Jim Ansara for his work at our virtual annual gala this year. Jim has been a tireless force in Haiti since 2010 and the earthquake that devastated the country. And that includes the work that he's done with Health Equity International and all the different projects, the Maternal Health Center, the Neonatal Intensive Care Unit, the Infectious Disease Center, the Surgical Center, and countless other projects at our hospital. But it also includes a national teaching hospital in Mirabelais through Partners in Health and other projects throughout the country and now throughout the world through the remarkable work of Jim and his team at Build Health International. As many of you know on the event tonight, no one works harder than Jim Ansara. He works on his emails till sometimes 2 o'clock in the morning, trying to figure out how to continue to drive projects forward. And he never accepts a given as a given. It's come at great personal sacrifice for him, for his family. And what it's really always been about is the same value that we hold dear at our own organization, health equity. It's really thinking through what it must mean to show up at the hospital gate at 2 o'clock in the morning, needing a C-section, knowing that your life depends on a building working properly, that equipment working properly, having a full team and the remarkable medical staff we have in Haiti doing their jobs to be able to make sure that somebody gets the care they need. Jim has never lost sight of that fact throughout the 10 years that we've been working together. It's just been a remarkable time, and we can't thank Jim enough for all that he has done to bring our work forward. And we look forward to working with him for another decade as we try to continue this work on health equity. Thank you, Jim, for everything. As you all know, health equity is the key mission of our organization. And we'd like to now share a video with you of some of our team talking about what health equity means to them.
Pour moi, Health Equity signifie une organisation qui aide tout le monde, sans discrimination, sans distinction. Donc pour Sud-là, c'est l'hôpital référence lié de par Jean soin de qualité qui c'est mission li et Jean li prend soin de tout le monde en général.
Health Equity means for me social justice, compassion.
Pour moi, Health Equity permet que tout le monde ait une santé. Que vous êtes riche, que vous êtes pauvre, tout le monde sur le même pied d'égalité.
Vous ne pouvez pas garder le visage du monde pour vous donner soin. Donc, ni moun ki pauvre là, ni moun ki riche là, donc yo jwenn même qualité soin.
Health equity vle di pou mwen kompasyon. Nou wè maladi yo tankou sete mèm nan fami nou, tankou maman nou, papa nou, pitit nou. Nou wè avèk an pil dignité.
Health equity ban nou yon santé ki preske gratis bo la kay nou. Nou pa bezwen soti bo isi ya pou nan ale yon lot kote.
It's like a family. It's a good lesson of solidarity.
We can provide with no differences whatsoever the same quality of care to everyone.
Health Equity International is, for me, a model that can inspire the entire world.
Thank you from the hospital that you're supporting. We know that things are very difficult these days, and that's why we are especially grateful to you, because all this work that you've seen tonight and more would never have been possible without your support.
Thank you all for joining us tonight. We know your schedule is incredibly busy, and we're grateful that you spent some time with us tonight for our virtual gala. We also know it's been a very difficult year for so many of you, and so many of you have stepped up to support us in our time of need. If you'd like to learn more about the organization, and if you feel moved to give tonight and to donate tonight to this work, you can find more about how to donate on our website. We're happy to answer any questions you have, and we'd love to talk to you more about our work. Thank you all. Have a good night. Please be safe. Hope you stay healthy. And thank you. Look forward to talking again soon.